right, enough of that. Let's get to our big story tonight. It is about our jails and a new report that described the situation inside as catastrophic. That's a quote. The highlights: the jail system in Multnomah County is understaffed and overwhelmed. Overwhelmed specifically with mental health patients who have nowhere else to go. I talked to Mike Benner about this earlier. Okay, so we're joined now by Mike Benner. And Mike, you have just read that 17-page corrections grand jury report. I mean, what are your takeaways?
Well, Maggie, I think that the staffing shortage is, of course, one of the takeaways. The other is a lack of mental health resources. But let's start with that staffing shortage. The grand jury described it as both a chronic and acute crisis. They noticed staff burnout and early retirements, all of it taking quite the toll on staff morale. The grand jury suggested the sheriff's office can improve staffing by offering hazard pay and assignment-based bonuses, maybe even hiring back some retirees.
So this is a familiar story. I mean, we know that staffing challenges are being reported across pretty much every industry at this point. So in this case, what has the sheriff said, if anything, about how he plans to address this?
The sheriff is not talking on camera, but he did release a statement, and he is calling this an immense challenge, adding that his office is already addressing the problem by ramping up recruitment, hiring, and retention efforts. Moving on to mental health, let's talk about our quote of the day. The jail system is beginning to serve as a de facto mental health hospital despite not being adequately equipped to serve such a function. That is based on witness statements to the grand jury. It appears the number of adults in custody suffering from mental health conditions and substance abuse has risen dramatically. The grand jury is advising the sheriff's office to focus on a few things. It starts with providing deputies with some mental health training, but also developing programs and hiring staff that can directly assist this vulnerable population.
So given all of that guidance, or at least those recommendations, what does the mental health staffing look like right now?
All right, so the grand jury found that there is one healthcare professional for every 6 adults in custody. Wow. They say staffing should be double, if not triple, the current levels. And Maggie, it is worth mentioning this grand jury report was not all doom and gloom. The sheriff's office was applauded for its robust assortment of programs available to adults in custody and for hiring its first equity and inclusion manager, a position Multnomah County DA Mike Schmidt calls essential.
All right, an eye-opening report. Mike, thank you so much.